Hi, this is Marie-Chantal from Tinnitus Therapy Online. Let's talk about hyperacusis. The word hyperacusis literally means excess hearing. Hyperacusis is an intolerance of certain everyday sounds that causes significant distress and impairment in everyday situations, whether that be social, occupational, or recreational. The sounds may be perceived as uncomfortably loud, unpleasant, frightening, or even painful. A study using the Tinnitus Research Initiative database showed that over 55% of patients who had tinnitus also reported having hyperacusis. As I mentioned earlier, not only can the sounds be uncomfortably painful, but it can also be coupled with what we call phonophobia. And that's an anxiety disorder, which is a fear of loud sounds. Typically, if hyperacusis is prolonged and self-managed with avoidance behaviors such as wearing earplugs or staying away from certain sounds, there's an increased chance of developing phonophobia. Therefore, a successful hyperacusis management plan will involve teaching the person to replace safety-seeking behaviors such as wearing earplugs to transitioning into a desensitization plan in becoming accustomed to hearing everyday sounds once again, while simultaneously reducing the associated fear response. So what are the causes of hyperacusis? Research on the specific causes is ongoing, and there is no exact understanding of a precise mechanism of how to just switch it on and off as fast as we would like to. What we do know is that it's linked to a dysfunction of the auditory nervous system and further exacerbated and sustained by the central nervous system. Some of the frequent causes of hyperacusis are prolonged exposure to excessively loud noise, exposure to sudden blasts of high decibel sound such as a gunshot, Meniere's disease, TMJ issues or temporomandibular joint disorders, scar tissue or damage after ear surgery, migraines, depression, Williams syndrome, brain injuries, and tinnitus, as I mentioned earlier. It should be mentioned that people with hyperacusis may or may not suffer from hearing loss, as it bears no relation to an individual's hearing threshold. In the next segment, I'm going to talk you through the link between hyperacusis and mental health, and this is absolutely essential to understand for both the patient and practitioners in treating hyperacusis. I'll see you there.